You. Today's topic is going to be urinary retention. You see our person up here with the frown? Not a happy camper because too much urine in that bladder. Why? Well, a lot of times it's just a blockage. Sometimes it's caused by certain medications. Sometimes it could be surgery. Sometimes it could be kidney stones. A lot of different things retain that urine in the bladder. But we know that sudden onset is known as acute. We know long-term is known as chronic. Each are treated a little bit differently. Causes. In men, a lot of BPH. That's enlargement of the prostate. For women and men, you get that stricture or narrowing of the urethra or urinary stones in the kidneys and whatnot. Again, it's a blockage. Got to take care of that. Symptoms. Okay, you have a hard time starting to urinate. You also might have a weak flow. Maybe just starting, stopping. You just can't get it there or it can't continue. Then we have the go, stop, go. This is a symptom that you're starting, you stop, but oh wait, I thought I was done. Nope, got to keep going. And it just repeats itself over one event. Then we have the all embarrassing leaks. Regardless, all are symptoms that there is a problem with the retention of urine in your bladder. Diagnosis. You're going to get that physical exam either by your PCP or your urologist. Then we move on to possibly a look at your urine. In this case, we're going to do a urinalysis and we're looking for any kind of bacteria buildup in there. Again, it builds up in the bladder, then it leaks out and we see what's going on. A cystoscopy, nice little shot of your bladder, make sure the tissues are intact and they're looking well. PSA is a blood test. Again, looking for the antigen in the male patient to see if they're at their appropriate levels. Are they rising? Are they below the norm? Where are you? Below is actually pretty good. The truss is nothing more than an ultrasound. That, again, is minimally invasive, but we're taking a nice picture of your prostate. Okay, what's the management and treatment? We're going to slow down here a little bit. The acute patient needs to tap that bladder, and we use that with a catheter. You need to open it up and relieve that pressure because they are in a lot of pain, and it is fairly serious. But if you're dealing with a chronic patient, they might be able to get away with just some medications. Some side effects to those, but hey, what's the invasiveness of it? Pretty minimal. All right. Going all the way down though, if you are a severe BPH patient, you might have prostate cancer, there might be a prostatectomy in there. That is the most aggressive. We just removed the prostate. In between though, what is there? Well, you've got the Urolift. Except for medications, the Urolift is right there as a minimally invasive procedure. You just go in, you open up the bladder neck, and you're flowing again. You're doing well. All right? After that comes the TURP or green light laser, in which we actually remove some tissues of the prostate so that you can open up that bladder neck. All right? For women, what about you? Well, in your case, you want to go ahead and exercise those pelvic muscles to get them tightened and toned so that you control that bladder movement. That might be all you need. Regardless of all that's going on here, you need to get diagnosed. You need to get treated. Go see your urologist.